Bioidentical hormones versus traditional synthetic hormones. What is the actual difference? Well, it's huge because bioidentical hormones, as the name would imply, have the same molecular structure as what you currently have or had before, while synthetic are something completely different. I'm just going to read you a statement. This is from the National Institute of Health, their database, and what it says is patients report greater satisfaction with bioidentical hormones that contain progesterone compared with those that contain a synthetic progestin. Bioidentical hormones have some distinctly different, potentially opposite physiological effects compared with their synthetic counterparts, meaning they work better, which have different chemical structures. Both physiological and clinical data have indicated that progesterone is associated with a diminished risk of breast cancer compared with the increased risk associated with synthetic progestins. That right there is enough to why would you ever use a synthetic progestin. Estriol has some unique physiological effects which differentiate it from estradiol, estrione, and CEE. Estriol would be expected to carry less risk for breast cancer, although no randomized controlled trials have been documented. I think that those are in the work right now, but we are definitely not seeing an increase in breast cancer. And as it says, we would expect some protective qualities from that. Synthetic progestins have a variety of negative cardiovascular events, which are avoided with progesterone. Synthetic testosterone. So this is stuff that is injected in usually twice a week. The problem with that is you get, boom, all of a sudden you're really high, 1500 with T, and then you drop down within 2 days back to your baseline, which is probably 300 or 400, and then up again and down again. That doesn't feel good. Additionally, with synthetic testosterone, you have increased risk of heart attacks and strokes due to the increase in hemoglobin and hematocrit that you will have. It's not a maybe it'll happen, it will absolutely happen, and you will have to start getting therapeutic blood draws at some point with synthetic testosterone. And that is why we only use bioidentical hormones at Wellness for Life. Please message me with any questions you have. I would love to talk to you about this.